My name is Tim Reed. I'm Director of Pupil Services for Nevada Joint Union High School District, and that encompasses overseeing special ed, mental health, and nursing. We started implementing mental health services in Nevada Joint Union High School District quite a few years ago. Really the START, which is our STARS program, our Student Assistance Program for general education students, started just over 15 years ago. And really it started with one or two clinicians that started on a grant, had an idea to bring general education services into students at the school. We were also able to bring many of the mental health supports in-house. So our alcohol and other drug groups, our anxiety groups, our other tangible things that used to be either volunteers, outside clinicians that we contracted with, or the county behavioral health. This was pretty well established as we started to hear about the first cohort of the CYBHI funding. We really fit the mold for this because we had a lot of it already in place. So we jumped on into the first cohort, and so it's been over a year now. We have 5 campuses, 2 comprehensive and 3 alternatives. So we have wellness centers that serve all of those. And then we created and staffed the Nevada Union Wellness Center last year as well.
My name is Tiffany Netherby. I'm an intervention case manager here at Nevada Union Wellness Center. The Wellness Center is a Tier 1 intervention for all students on campus. We really see ourselves as more of like a place to reset and, finish off the day strong. My main role is like getting kids regulated and back to class. Oftentimes they come get a snack, maybe have a chit chat, sometimes quiet time. So I like to watercolor with them. It's really fun to just like watch their creativity sort of come alive with just like simple water and paint. We have like some meditation that they can do if they like. It's guided, it's like on our website. We don't do homework, we don't do phones. So really it's a time to just like get regulated. We have multiple social workers and therapists on campus. We have a worker of the day, so if it's like a heightened crisis, I can pull them in, but then I can also make referrals to them if it's not an acute crisis need. Oftentimes, teachers do send kids down to me because they've noticed a change in mood, they've noticed a drop in grades, they know that something major has happened, so they know that this is like the first resource on campus before they can get referred to ongoing therapy.
I have seen incredible growth in the services that are offered in our schools, and so I have been along for the whole ride for when I was, one of the only staff that provided mental health services to now we have a whole team. And so having a funding stream that supports a wider range of services has been incredibly helpful. And like opening this wellness center and just having lots more options of things that we can support our students with. Any student has access to the wellness center, and really I can provide, because I'm a licensed therapist, I can provide a wider range of services.
Hello, my name is Dan Kingold. I'm a licensed marriage and family therapist, and I work as a mental health therapist at the STARS program here at Nevada Union High School. It stands for Student Assistance and Resource Services. We offer mental health services for students from the entire campus population here. I see students generally once every other week and provide mental health services for any issues they have, often dealing with academics, but also just the larger challenges that are going on in their lives. I really enjoy getting to develop a therapeutic relationship with the students and to watch them come in with challenges, and through the work they do by talking about and processing things that are going on or things that have happened in the future, and by helping arm them with skills and coping mechanisms to, one, integrate better into the school and have a better time with academics and have less conflict with peers and the staff, but also just be able to look more into the future for themselves and think about what they want to do with their lives after high school.
On a broader scale, the most rewarding part is that having CYBHI's involvement and allowing us to further expand the services and supports that we can provide, and sort of seeing the end result from when I started. Like I said, it was very grassroots. It felt very sort of always on thin ice, and now it feels a lot more like there's stability and security in that. So in that regard, it's nice to see it come from a very like pioneering stages to a stage where it feels like, okay, now we've sort of made it, like we're here, like mental health is a part of the school system and can be spread even further throughout the state. On a smaller scale, it's just nice to see students find a place where they feel welcome and they finally feel like school is clicking for them and that they're able to have a positive school experience where in the past it has not been anywhere close to that. So seeing both of those things happen simultaneously is a very rewarding part of this job.
Primarily through STARS, we do individual therapy. And so sometimes it's very short-term therapy and sometimes it's longer therapy. Having therapy on campus is amazing because they don't have to miss school. It's much more convenient for a student to be able to take time out of a class and come in just briefly for their therapy session and then get right back to class. I think that it's becoming more known by the students that there are clinicians on campus that they can see if they need to, and they know what the process is to get in to see a clinician. I think that it makes a lot of the students feel a little more grounded in some ways because they already know that there's somebody here that they can talk to if they're really struggling and that they can get in pretty quickly to see the therapist that they've been assigned to. You know, we've worked really well with the teachers and they've worked really well with us. We try not to call a student out of the same class over and over. We look at their class schedules to make sure that we're not calling them out of physics or something like that, but we call them out of a class where if there's work to make up, they can easily do that. They might get called out of an art class or maybe a dance class, something like that. And the teachers have all been very accommodating and super helpful. I think that they appreciate knowing that there's help on campus also. One of the most rewarding things is getting to see a student, and I was just telling the director this, there's one student that I have seen since she was a freshman and have been able to see her now she's a senior, and to see the growth and the confidence and the skills that she's utilizing to help manage difficult feelings, how she deals with friends and friend groups and setting boundaries. So being able to see that level of growth in somebody, not just because they're getting older, but because they're using some of the skills or many of the skills that they have learned in therapy, and to feel like, just in general, getting to work with this population is super great because they're so like sponges and want to really know how to do things. Often what we're doing is planting seeds. Sometimes we don't see the actual outcome of the efforts, but we're planting seeds for these students so that they know therapy was a good thing. I know that I can always go back and do that again if I need to. And this thing that I learned, this little kernel of information that I've got now, I can bring with me into my adulthood and know that it'll be useful.
Deep, dark clinical work needs to happen outside of the school setting, and we want to support that as well. And we'll walk with a student to do that with a warm handoff through our care sols into another provider. But parents are often worried, like, what are we doing and why are we in this space? We're in this space so our students feel safe at school and can get back into the classroom and learn at high levels.